Cardiovascular Center as a part of the program there, targeting anxiety and depression and stress reduction with cardiac patients. So it's a pleasure to be here. Thank you so much for the invitation. Asked to talk today a little bit about stress management, particularly during the holidays, but I think a lot of these strategies can be used year-round. So let's get started with a little bit of information on what is stress, talk a little bit about, or give some data on stress during the holidays, and then look at different skills for managing stress and techniques for stress reduction. So, stress. I'm sure everyone has their own definition for what stress is. You probably can think about it and feel it in your body as soon as it's mentioned. But a basic definition for stress is that it's the brain's response to any demand. This is often brought on by a change of some sort, and it can be a positive change or a negative change. It can be a real or perceived situation as well. And you know, stressors can be short-term, they can be recurring, they can be over the long term. Things like commuting to and from work every day, or traveling on your yearly vacation, or moving to a new house, all sorts of different things like that. Could be, you know, could be a mild stressor like watching a scary movie or riding a roller coaster. Could be something major like a marriage or a divorce, or something more extreme like exposure to violence. And you know, we think of that as more something that could lead to like a traumatic stress reaction. So in general, stress is activation of our body's fight or flight response. And in short term and in certain situations, this can actually be really beneficial. Any of you have kids? Yeah. Any of them run someplace where they shouldn't at some point? So that fight or flight response, right, picks you up, you get that increased respiratory rate, heart rate, a little bit of energy to chase after them and get them away from the moving car or whatever else that they're running towards. Over longer periods of time, however, chronic activation can be pretty problematic, and this can happen if the source of stress is constant, or if the stress response continues after the danger has subsided. Some of the things we see associated with chronic stress, people are more prone to frequent and severe viral infections, vaccines are less effective, increased risk for all sorts of wonderful health problems, many of which I'm sure you see in your patients all the time. So when we think about holidays, how does this come into play? Holidays are supposed to be a fun period of time, right? All sorts of shoulds associated with it. The American Psychological Association did a survey recently, and about 80% of the respondents anticipated that they were going to experience high levels of stress during the holiday season. They reported a range of symptoms, so large proportion reported feeling nervous or sad. Lots of people had difficulty with sleep or feeling fatigued. Some reported lack of interest or motivation, headaches, muscle tension, upset stomach, all sorts of wonderful side effects. They also noted that many people use coping skills that actually increase their stress in the long run. So things like eating, using alcohol, particularly during the holidays in order to manage their stress. Okay, exciting. It makes everybody really excited about the holiday season, right? So what can we do to actually decrease our vulnerability for stress or help manage the stress during the holiday season? And the first thing that I'd recommend is actually focusing in on kind of those foundational skills. This is something I always touch base with my clients on. This is something that I check in with myself when I'm feeling a little off. Is there physical illness that's going untreated? Am I feeling under the weather? How many of you can think of a time where maybe you had a cough or you had the flu, and you just didn't handle things as well as you would have otherwise? making sure that you are balancing your eating, so not eating too much or too little, making sure that you get regular meals. I always think of, I think it's the Snickers commercials right now, you're not yourself when you're hungry, that kind of hangry, you're just very different if you don't, or many people can have difficulty in managing stress when they're hungry, and I see the dietitian nodding at you. So I have additional backup on that one.
I carry a snack with me all the time, so if you ever need one.
She's the go-to girl. Things like avoiding mood-altering substances, making sure that you get enough sleep. Probably know some people who can go on very little sleep. I'm not one of them. I go below 7 hours and they just don't do as well. So knowing for yourself what it is that you need to have in order to feel kind of at your best. And then exercise. We all know that it's good for us. We all probably think we should do it a little bit more. But there's some great, excuse me, some great evidence showing that regular exercise actually can have a similar antidepressant or anti-anxiety impact as some medications. So, huge benefit, and anything that you can do is going to be better than nothing. And the important piece here is to know your own personal vulnerabilities. So I mentioned a couple for myself. I drop below 7 hours of sleep a night. It's a big one for me. Sounds like someone who always carries a snack, perhaps that's something that is more of a vulnerability for her. My guess is you can all think of a couple of things that you are more sensitive to. Another basic strategy that people can use, and this is kind of a big buzzword right now. How many of you have heard of mindfulness practice? What's your understanding of what mindfulness is?
Being present.
Yep, being present. Someone else committed to?
Being in the moment.
Yeah.
Paying attention to what you're doing.
Yeah. So that intentional in the moment and without judgment and without attachment. So not putting a value on what it is that you are in the middle of. We all go through our days and we need to make some labeling judgments, right? So it's the chair, it's the table, but it's not a value judgment, good, bad. And that's a big component of mindfulness as well. I think it brings the curiosity in addition. It's always a nice change. I think that one of the important pieces to remember with this is that you're going to increase your awareness of what's going on in your body, in your emotional life. At times it's going to be uncomfortable. And that's something that sometimes gets left out in the kind of sound bites on mindfulness. But if you think about it, you're increasing your awareness, if something's going on, it might be uncomfortable, and that's just an important thing to remember. But the great thing about this is it gives us an increase in our choices. So when we notice that we're feeling stressed, we're feeling overwhelmed, gives us almost like an earlier opportunity to make a change and do something different. So another thing that can be helpful, particularly around the holidays, is to kind of, in the sense of being in the moment, being present, is to step back and take some time for reflection. Think about what the holidays mean for you. Reflect on cherished memories. Think about what you're most thankful for. And if this were to be your last holiday season, what would be most important to you? If, however, some checking in on your foundation, stepping back, questioning, and if that's not helpful in terms of reducing your stress, then it's important to have some alternative skills you can go to. My guess is that you all have a couple of things kind of in your back pocket. I know I can do this if I'm feeling really overwhelmed and I'm going to feel better. But like to bring in a couple of new things for everybody. So things to think about include regular meditation or prayer, as well as breathing exercises or progressive muscle relaxation. Anybody have a breathing exercise or do a progressive muscle relaxation when you're feeling stressed?
I do breathing, just counting.
Mm-hmm. Yeah, that's a great one. Anybody else?
I do it periodically to get my blood pressure down before I go to bed.
Yep. Very, very important. So at the back of your handout, I actually have a couple pieces, or a couple specific handouts on progressive muscle relaxation and then on some breathing exercises. But I actually want us to go through a really basic breathing exercise together today. And what I'm going to have you do, first of all, is many of us don't really breathe correctly anyway. We breathe from up here, because we're all told to tuck our tummies in, right? Something like that. So we breathe from up here. And last time I checked, my lungs aren't up here, down farther. So thinking about allowing the belly to expand when you breathe in, and then almost thinking about that belly button going back towards your spine when you breathe out, pushing the air out. So I'm going to ask everybody to sit comfortably in their chair, feet on the floor, and just start to bring your attention to your breath. Noticing that your stomach expands as you breathe in. And then as you breathe out, pushing that air out through your lungs, pushing your belly button back towards your spine. And what we're going to do is we're going to slowly extend the length of your exhale. So you breathe in for a count of 4. 1, 2, 3, 4. Hold. And then breathe out. 1, 2, 3, 4, 5. And you repeat that cycle. Seeing if you can extend your exhale even farther. Okay. Any observations? Anything you've noticed about your body as you go through that?
I go to sleep. We just got done with lunch.
Yeah. Yeah. So I love this one because it's really easy. It's really quick. You can kind of do it anywhere. But by extending your exhale, you're actually sending a signal back to your brain saying, this is the time to relax. Really basic, but really convenient to do before you head back to clinic patients or anything like that. And then there's just a couple of different exercises at the back of your packet. If those are something you're interested in, take a look. There's lots of other resources as well. Another thing to be aware of is if you have thought patterns that can increase your anxiety or can increase depressive symptoms or increase your irritability. So some of these patterns include negative thoughts about yourself, self-criticism, negative thoughts about the world, negative thoughts about the future, and these really maintain symptoms of anxiety and depression. My guess is you can probably come up with a couple of your own thoughts that are less than helpful as you go through your daily life. Some holiday-specific things that I think come up for lots of people is that I have to make this a perfect holiday. I have to make this a perfect celebration. Or I must say yes to every invitation that I get. Or I must be happy because of the holiday season. So if you notice any of these patterns in yourself, first of all, approach it from a place of curiosity, not from a place of, oh, I'm thinking that again. That's not going to be helpful. But start to almost have a conversation with the thought, or start to question some of it. So, is the thought valid? Is it helping me to worry about this right now? Because there are some things we have to worry about. I have to have a little bit of worry, and I remember to pay my bills, and that's a helpful thing. But there are other times there are things that I can't make any changes to, and so worrying about them just gets in the way of my job, other things. So you can challenge your sense of needing to do something right now, or fix everything, or take care of all of the chores. If you notice negative self-statements, seeing if you can turn them into positive. So something like, oh, I'm late again. Oh, yep. But it's obviously very important for me to be at this program, and so I get here as quickly as I'm able to. Sometimes playing around with the thought can be helpful. Can sing it to the tune of Happy Birthday, anything to just move yourself out of the pattern that you're normally in. And then finally, to check your interpretation. Was that an accurate assessment of what just happened? I walked into the room and she didn't immediately greet me. Was that because she didn't want to talk to you? Oh no, she was setting up the video camera. Right, so what's the interpretation of a situation? And no, it's not what you did at all, you were wonderful. The beneficial thing is to actually work on cultivating positive experiences. So we are hardwired to pay much more attention to negative experiences than positive experiences. We've needed it for survival. But knowing this, if we feel like we're not having enough positive experiences in our life, then it's important to intentionally start putting things in. And now, yes, it would be wonderful if we could all go to Hawaii whenever we were feeling stressed or whatever, would make you feel good. But not really an option for me. Guessing probably not an option for you guys as well. So finding things in your everyday life that are easy to, or relatively easy to put in, that are accessible, and that give you pleasure or enjoyment. Listening to soothing music on your commute, taking a little bit of time to read before bed, enjoying your coffee in the morning, whatever it is that works for you, but doing so intentionally. And then, taking some time to evaluate what your goals are, what you value, and seeing if there are changes that need to be made in your life so that you can have more of these positive experiences in the future. Another important thing is that we need to have purpose in life. We see a lot with people when they retire, they no longer have their job, the thing that they do every day. And so having something in life where you feel competent, where you feel effective, can be really helpful in terms of decreasing stress and increasing positive experiences. And the idea here is to pick something that is a little bit of a challenge for you, but not something that's right at the top of your ability level, and to work your way up. Okay, so thinking about those situations that you know you're going to have every year, whether it's a stressful in-law or anything like that, where you know you're going to encounter them. One thing you can do is actually do some rehearsal ahead of time. And this is pretty cool. So the power of rehearsal. There was a great study looking at high school basketball players. And they split the team into two groups. One, they have actually practice shooting free throws for a specific amount of time each day. The other group didn't have them touch the basketball during this time, had them visualize all of the components of shooting, but then also visualizing that successful completion of the shot. And guess which group had a better percentage afterwards? Yeah, the rehearsal group. So if you know that there is going to be a challenging situation coming up, thinking ahead about what skills you're going to be able to use, and imagining the situation as vividly as possible. Rehearse in your mind what you're going to think, what you're going to do, what you're going to say, and actually think about what the worst possible outcome could be and how you would handle it. And then practice some relaxation afterwards. This isn't, if you try a bunch of new techniques, nothing's really sticking, you're still feeling overwhelmed, always encourage people to just reach out for help. Whether it's friends, family member, religious or spiritual advisor, healthcare professional, mental health provider, whoever it is that you feel confident in talking with. Very, very important.
Any questions?